Hello, this is Dr. Andy Keith. I'm here to talk a little bit about non-surgical spinal decompression. We have Ellie here. We've done an exam with her, found some things that indicate she has a lumbar disc injury, and we're going to do a little bit to show you some of the findings for that and then demonstrate the non-surgical spinal decompression. Again, Dr. Andy Keith from Socal Regenerative Medicine Clinics in Anaheim and in West Covina. So let's go to Ellie. Hi, Ellie.
Hi.
As you remember, as we did our exam, you found that you had some weakness in your legs. So I'm going to just do that one more time. Let me have you uncross your legs. Bring your right leg up, your toe turned in. I'm going to be pressing out. You resist as hard as you can. Okay, resist. And that's rock solid, which is what we want. Turn your toe out, and I'm going to push in and you resist. Press against my hand. Perfect, perfect. Okay, now bring this leg up. Turn your toe in, sorry, right there. Okay, and I'm gonna push out and you resist. And that moves fairly easily. That shows there is a weakness in that tibialis anterior muscle. That muscle has to do with your lumbar vertebrae in the back. Okay, let's check the other one just for fun here and resist. And your peroneus muscle is fine. So what I'm going to have you do is you're going to touch a spot on your tummy right about here. So just with a couple fingers right about there. This is a reflex point that lets me know if there's a connection between your low back and the leg muscle here. So turn your toe in again. I'm sorry, let me do it for you. Right there. Hold. And you can tell that's definitely stronger. Okay.
Wow.
Okay, now relax your leg. So that just shows us that there is a problem that's more than likely treatable. And we want to find out the best way to do that. There are several options. There's chiropractic, physical therapy, there's acupuncture, there's medical treatments. If it was very severe, they'd be talking about surgery to cut the disc and take the pressure off the nerve. Obviously, yours is not a surgical case. We're going to go towards the spinal decompression for you. So I'm going to come over and do a couple steps again. So what I'm going to do is have you hold your arm up. I'm going to press down and you resist. I'm going to put kind of a compression pressure on your low back. So I'm just going to squeeze your low back and hold your arm and see how it's very weak. Okay, I'm going to distract it. So I'm pulling your spine apart like that, and now hold. And you can tell that that is very strong. Okay, so that shows us that your body wants to have the pressure taken off of the disc, off of the nerve, which is what non-surgical spinal decompression does. Okay?
Sounds great.
So, non-surgical spinal decompression is a very safe treatment. There aren't many doctors that have a true non-surgical spinal decompression machine. In our office, we have the DRX9000, which is the better machine, the best one that's out there. It's kind of like the Cadillac of decompression, if we're going to call it that. And let me show you this little picture. What we're trying to accomplish here is your discs are between the two bones. As they get compressed, that will cause the disc to protrude, and it can protrude against a nerve. Okay. In your case, it's affecting that L4 for the tibialis anterior muscle. If we pull the bones apart, like this little picture is demonstrating, what that does is creates a negative pressure on the disc. That negative pressure over time will move the gel that's inside the middle of the disc towards the center, and it will make that protrusion smaller, and in some cases actually resolve it completely. Okay? So in the machine, you'll be lying on your back. There's a strap we can actually adjust to the specific disc level we want to treat, and then we can start our treatments. Normal treatments are about a half hour. Again, very safe, they don't hurt, and most people actually fall asleep on the table. Okay, Ellie, are you doing okay?
I'm doing great, thanks.
Great. We're going to let Ellie rest. As you can tell, she's on the DRX non-surgical spinal decompression machine. It's set at L4, affecting the L4 disc. It is a very comfortable treatment. She's in no distress. We can leave her. She can relax and go to sleep. Dr. Andy Keith, looking forward to treating a couple more patients while she's in from Socal Regenerative Medical Clinics in Anaheim and West Covina.